Good morning. Today we will discuss safe administrations of medications. This will be presented by myself, Allison Schmitt. As many students reflect on the administration of medication to patients, they become fearful of making a mistake or a fatal error. This is a very real and valid feeling, and it's an important one because, as Alexander Pope said, to err is human. As Christians, we can reflect on verses from the Bible to help overcome these fears. As this one says in 1 Peter, casting all your anxieties on him because he cares for you. Let's think about this as we go through our lesson today. In today's lesson, our objectives will be discussing safety checks for medication administration, providing examples of high-risk medications, and reviewing the additional steps with narcotic administration. So let's talk a little bit about medication errors in general. Did you realize that medication errors are the third leading cause of death in the United States? Some estimate that as being roughly 440,000 people dying yearly from medication errors, which averages about 1,200 people a day. 1 in 3 patients that enter the hospital will experience some type of medication error. Now, this may not be a fatal error, but just some type of error, given too little medicine, too much medicine, or the incorrect medicine. They estimate that these errors, both the fatal and non-fatal, cost the United States about $15 to $28 billion a year. Many of these errors are preventable, so they are all truly human error. Think about who you think is responsible for making these errors. Do you think it's the physician who orders the medication, the pharmacist who distributes it to the staff to administer, or the actual staff that is administering it, or all of them? Just some food for thought. Let's take a couple minutes to watch this YouTube video on the Josie King story. It will put into perspective just how vital medication administration is and how devastating a mistake can be. After watching the video on the Josie King story, I hope that you have realized that it is not just the nurse's role, but everyone's role who touches that order or administration of medication's responsibility. We all need to check and recheck after the order has been prescribed to the time that we give our patients medicines. So let's discuss some safety checks during that actual administration. These are the checks that ourselves as nurses and bedside nurses can do to ensure that we are giving the correct medication to this patient. One of the first rules that we'll talk about are the 5 rights. These are looked at every time you give a medication. Those 5 rights include having the right patient, having the right drug or medication, the right dose, not only prescribed, but the right dose for that patient. If you will, think about those pediatric patients. The right route. Are we supposed to administer this medication by mouth or PO, or rectally or intravenously, and the right time. Are we giving the medications too soon, too close together? Are they due that dose of that medication? Because giving medications too close together or too far apart can lose that therapeutic measurement that we're trying to do with those, or could cause harm. Another safety check are the red rule identifications or identifiers. This is where you are interacting with your patient to make sure that this is the right patient. So you want to ask your patient to state their full name and their date of birth, and then you want to check that against the patient's identification bracelet. Even if you have been in this patient's room all day long, every time you go to administer a medication, you want to ask them for their full name and for their birthday, and to verify that with the ID bracelet that they have on their person. Let's now discuss some of the barriers to safe administrations of medications. What are some reasons why nurses have difficulties administering safe medications? One of them is the nurse's workload. Nurses are responsible for more things at the bedside than they ever have been in the history of nursing. And they just keep coming. Adding things to the nurse's workload makes them feel very pressured to work very quickly, and this gets in the way of administering medication sometimes. One of the nursing workloads is the patient-to-nurse ratio. It used to be that nurses who worked on a regular floor only cared for maybe 4 patients during their shifts, and now we're seeing it to where they are upward in caring for 7 and even 8 or more patients during their shifts. So adding those patients increase that workload and once again make them feel very pressured. And lastly, interruptions in the nursing workflow. Phone calls, alarms going off in patients' room, call bells going off in patients' rooms, families needing to speak with the nurses, patients needing to speak with the nurses. All those things, while are all very important to the nurse's daily shift, they do add interruptions to it. All of these barriers are concerns when it comes to administering medications. Another area of concern generally when administering medication is those high-risk medicines. Now, what makes a medicine considered to be a high-risk medicine? Those are medicines that have a high chance of causing harm if misused or used incorrectly. And they have a very narrow therapeutic index where we really need to be mindful with these medications. A couple examples of high-risk medications are heparin, for instance, which is an anticoagulant which thins patients' blood, and this has a very narrow therapeutic index of where we want that patient's blood to be thinned, but not too thin. Another high-risk medication is insulin. We, of course, do not want to cause hypoglycemia in our patients if we administer too much insulin. They have additional steps when we administer them. For instance, with insulin, anytime you're going to administer insulin, especially when you're going to administer it intravenously, you're going to have a second provider, a second licensed provider to administer medications, check that insulin dose with you. So you're going to pull that medication up and then take the vial and the syringe to someone else to ensure that you're administering not only the correct dose, but that the correct dose is in your syringe. These medications also require additional teaching for patients and or their family members. You want to empower them to know what they are having administered to them and to have that questioning attitude to ensure that the dose is also correct for them or for their loved one. Putting more back into the patient's or the family's empowerment will also help to ensure that they are getting the correct medication dose and the correct medication with these high-risk medicines. Lastly, let's talk about narcotics. What is a narcotic and why do we have them? Narcotics are good medications when they are used appropriately, but they are considered controlled substances because there is a high potential for abuse or dependence on these medications if someone uses them for so long. Some examples of narcotics are Percocet, codeine, morphine, fentanyl, Dilaudid, all medications which you are probably going to administer in your nursing career at some point or another. The extra measurements are taken with them because of them being that controlled substance. The extra steps needed are when you go to remove the medication from a medication dispensing machine or even from a drawer. You're going to have to sign that medication out. And if you do not use that whole medication that you've signed out, whether it's a tablet and you've used half a tablet, or it is a liquid and you're not administering the entire liquid, either PO or intravenously or as an injection, you are going to have a second nurse or licensed medication administration provider sign out that you have wasted that medication. You also have to waste it in a set place. It used to be that we could just put it in a trash can or put it down a sink, but now there are tools and resources available to you to dispense that extra medication into them, so that medication is then dissolved. We want to make sure that we take all these extra steps every time we administer a narcotic for these reasons. That's the end of our lecture for today with a generalized overview of administration of medications, different safety checks and extra checks when administering narcotics. We will get into more depth as the semester moves forward. I hope y'all have a great and wonderful day. God bless you.